for today. I'm going to begin with simply by stating addictions are chronic diseases, much like diabetes, hypertension, and asthma, right? So this is something we've known for a long time. This was a seminal paper. When I work with our addiction psychiatry trainees, our addiction medicine trainees, this is actually often the very first paper that I like to share with them. This paper was published in the Journal of American Medical Association way back in 2000, where the authors, they took, various substance use disorders, what were back in 2000 called dependencies, right? Cocaine dependence, nicotine dependence, opioid dependence, alcohol dependence, and compared them to diabetes, non-insulin dependent diabetes, hypertension, and asthma. The first thing they looked at was genetic impact. How much of the impact comes from the genes versus the environment? And there were no differences. Doesn't matter what illness we're talking about half of the impact comes from a person's genes, and the other half comes from the environment, right? So the contributions of environment and personal choice were found to be comparable. And similarly, medication adherence and relapse rates were also shown to be similar. So really the case was made in this paper very appropriately that just like any other chronic illness, we should be providing chronic treatment to patients who have substance use disorder, right? Long-term ongoing treatments are proven most effective, as we would expect in chronic illnesses. And still, I think this doesn't always happen, right? Even in the year 2024, very often we continue to apply acute treatments to chronic illnesses. Things like, that 7-day detox or 5-day detox or maybe a 28-day rehab, but those are all acute models. If we want our treatments to really work, we need to approach this from a chronic disease standpoint. And I would argue that one of the big reasons why this keeps happening, why we continue to treat substance use disorders somehow differently from other chronic illnesses, is because of stigma. So let's start going into that. Addiction appears to be among the top, if not the top, most stigmatized conditions across different societies. There's lots of data around the world, including here in the United States, showing that people who have substance use disorders are highly stigmatized. And when I think about it, there's often this intersectionality, right? Like there are often layers of stigma that our patients experience. Stigma because of substance use disorder. Maybe there is stigma because of being unhoused, or maybe there is stigma because of because of other things, right? Ethnicity, race, gender, etc. So often all of these compound and further create barriers to recovery for our patients. And even compared to other mental illnesses, which are already so stigmatized, people have even more stigmatizing and discriminatory views towards those with addiction disorders, substance use disorders, right? And so this was a kind of a nice little study, a big survey in the Western world in 2014, right? And here, the things that are in blue are people's attitudes towards someone with a non-substance use related mental illness, and the red is substance use disorder. And you can see that 62% said they would be okay working with someone with a mental illness. I still want to point out 38% still wouldn't work with someone with any mental illness. That number was 22% for someone with substance use disorder, right? 64% believed employers should be able to deny employment to people affected by addiction, right? 43% opposed giving individuals with substance use disorders the same health insurance benefits granted to otherwise healthy individuals. 90% were unwilling to have a person with a substance use disorder marry into their family, and over half thought landlords should be able to deny housing to a person with a substance use disorder. So, I would encourage everyone just to pause and reflect on that. How would our lives be like if these are the attitudes which we were confronted day in and day out as we lead our lives? So I think this is quite significant, and we as healthcare providers are not immune from this stigma. It's been shown that healthcare professionals receive violence, manipulation, and poor motivation as factors impeding healthcare delivery to patients with substance use disorders. And I know we have maybe a couple of trainees here on Echo who now been rotating at ASAP. And, I would ask you, especially as you work with people with substance use disorders, to really reflect, like, how often have you seen people, like, are all our patients coming in being violent, trying to manipulate us and have poor motivation, or have you found other things, right? I would ask you to reflect on it. You don't have to chime in. If you feel like chatting in, you're welcome to, but you don't have to, right? But this is often the view that's held by healthcare providers. And it's been shown that psychiatry resident attitudes towards patients with substance use disorders actually worsen through the course of their training. So I think this has some real training implications, right? Which is maybe a topic for another day, but I certainly think about this a lot. Why is this happening? Why are the views becoming more stigmatizing? And what are the things that can be done to really combat that or change that? And certainly lack of training, education, and support in working with these individuals, I think, is a big part of it. So next, I want to go into stigma and language, right? Um, so is it just semantics? Is it not just semantics, right? Is it just political correctness? Why should we care what language we use if we're doing the things we're doing and if we're treating someone? So this is kind of an old study, but it's a classic study. And here, what the study authors did is they gathered two groups of lay people, right? Two groups of people. They were randomized, and they both read the same vignette, the same little story. Everything was the same, except one group read about a substance abuser, and the other group read about a person with a substance use disorder. So the only thing that was changed was this descriptive labels. Everything else was the same. And then they asked them, what should happen to the person? How should we approach them? How should we try to intervene, etc. And what you found was the black line is the people who read about the person with a substance use disorder. The white bar is the people who read about the substance abuser. And you can see that if you read about a substance abuser, less than half were likely to say the person should be in treatment. But if they read about someone with a substance use disorder, that number jumped to 70%. And look at this, the punishment, right? I'm just highlighting a couple of them here, where, if you read about the substance abuser, 70% of them thought the person should receive punishment. And that number dropped to under 25% if they read about a person with a substance use disorder. So pretty striking, right? So I think language does matter. Language does really impact perception of our patients and oftentimes can play a role in public policy and how we approach and how we provide treatment and interventions. And indeed, studies show that stigma worsens outcomes. So let's talk about that, right? So one of the things that's been shown is that when people are faced with stigma, right? Stigma from the society, families, even healthcare providers, as we briefly touched upon, that stigma often gets turned inwards, right? The stigma gets internalized. And that's often called self-stigma. That stigma that someone is like sort of turned towards themselves. It's internalized public stigma and can come with things like shame, guilt, low self-esteem, low self-efficacy. I can't do it. I don't think I can do it. Why try effect? Why should I try? Along with things such as demoralization, feelings of inadequacy. So I think there are some real harms to self-stigma. Oftentimes I think I find this pretty poignant that I am what you label me, because that's often what gets internalized. And this is, again, somewhat of an older study that looked at perceived stigma amongst patients with substance use disorders. And it was very common. It found that, over half, 60%, thought people treated them unfairly because they knew about their substance use. Again, about a half thought people were afraid of them when they found out about their substance use, and almost half felt abandoned by their family because of their substance use. And it's been shown that addicted individuals, when they perceive this stigma, when the stigma is internalized, are less likely to seek help or treatment, report high discrimination, and more likely to drop out of treatment if they even seek treatment. So outcomes get worse. And healthcare professionals often will hold people with substance use disorders, that's what this SUDs is, in poor regard. Again, see them as manipulative, violent, poorly motivated, and actually may avoid the patients or shorten visits, leading to suboptimal care. So there are, again, real implications. So here I listed some of the components of recovery as defined by SAMHSA and many other professional organizations, right? Hope is the cornerstone of recovery, according to SAMHSA, hope for the future. Other components include health, both physical and psychological, having a safe, stable place to live, having a sense of purpose, and having a meaningful engagement in the community. And these are some of the things that have been shown with stigma. Less likely to seek and stay in treatment, worse mental health, worse physical health, decreased employment, unstable housing, breakdown of social support systems, right? All things that directly go against the components of recovery or really sort of oppose them. So perhaps unsurprisingly, stigma does lead to worse outcomes for individuals with substance use disorders. And I think this is ultimately why we should care. So lastly, I will end on, and I said I will end with plenty of time, and I think we're on target here. What can I do? What can we do? So, this is sort of stigma from a harm reduction lens. So I included this, and these are some of the principles of how we view stigma from a harm reduction, perspective. First of all, we accept that stigma exists. As the slides have hopefully shown, stigma is there, and avoiding it or ignoring it or not thinking it doesn't exist really doesn't help anyone. So we have to accept that stigma exists. But we also accept that there are ways to manage and to actively challenge stigma. I would argue that if we are working with individuals with substance use disorders, certainly it is our ethical duty to actively challenge stigmatizing attitudes when we come across them. We accept that stigma interacts with other forms of marginalization and oppression. And when challenging stigma, right, it becomes very important. If we just go on attack, if we just automatically go on attack, we may meet with a lot of resistance. So I think starting point is meeting people where they're at, even the stigmatizers. Acknowledge that change can be hard, right? To add some, I guess, humanity to it, but it doesn't mean we become complacent. We keep working towards it. We keep sort of chipping away at it. Are just some sort of thoughts on stigma from a harm reduction lens. And then, this is really from SAMHSA's anti-stigma toolkit that they'll put forward. Like, what can you do at different levels? So at an individual level, and I think this applies to all of us, right? First of all, we kind of have to reflect on it. What are maybe our blind spots? What are our views that may be stigmatizing or maybe unfair to others, right? And sort of, so kind of honestly appraising our own thoughts and attitudes. We all have them, and I think we have to sort of open ourselves to reflecting on it, and kind of working on language, right? And I think if you hear someone use stigmatizing language, maybe gently suggesting an alternative, for example. Relationships, disclosure and dialogue. I think this is important, takes a lot of courage, right? And I always say this, that, people with lived experience, when they make a statement, when they share something, I think that's very important, takes courage, especially in light of these attitudes that we talk about, but can also be very powerful. And ongoing education, ongoing personal development, I think knowledge often is a big step forward, towards that. So that's one. At a staff level, so if you're working in an agency, things to think about at a staffing level, again, ongoing training and education. I'm a firm believer, and I agree with this, that education, learning more about the science of substance use disorder, talking to people with substance use disorder, learning from them can really help us develop and shape our views. Providing outlets for feedback, assessment of practices, kind of doing a fairly rigorous assessment, what's working, what's not working, and hiring drug users, hiring people with lived experience, and sort of allowing them to share their experience and play a role in sort of a agency-wide dialogue, can be really important. And at a community level, participant advisory boards, awareness campaigns, right? Policy and advocacy, events, all of these things can really make a difference. And ultimately, I think these are just some simple things, right? Treat people affected by addiction with respect. Learn about the science of mental health conditions, right? Not just substance use disorders, but others as well. Correct others, right? May have misconceptions about substance use disorders, mental illnesses, support resources, educate. And really, I think it's important to appreciate that most people with substance use disorders do go on to make recovery. with treatment and lead productive lives. Being a personal witness that puts a face and voice on recovery, working on changing our language and terminology, always being advocates for our patients, right? To create sort of accepting patient-centered environment, combating stigma, and maybe working with tribal, state, and national leadership to enact policies. Policies impact outcomes. So I think especially if you're in a position where we are experts in the field or seen as experts in the field, very important to be engaging with that policy arena to ultimately benefit our patients and our communities.